Hi, good evening. Steve Adler. Got a minute? Let's talk about the virus numbers with the dashboards we have. But first, let me wish you a happy Indigenous Peoples Day here on Monday. You know, the land that we're on here in Austin was land that used to be the land of the Tonkawa Indian nation, also the Comanches and the Lipan Apaches. In 2017, the city council decided that we ought to be celebrating those indigenous people who were the earlier ones on this land. This area around Austin, where we are, is one of the longest continually inhabited sites in all of North America. You know, perhaps because of Barton Springs, perhaps because of the hill country, and there are just so many geological formations that cross here. But this was the gathering place. It's been home to different groups and bands and tribes of indigenous people for at least 13,000 years. The city of Austin wants to recognize those folks. We have too many in our systems in our city that have not had the same kind of advantages, and those kind of systemic racism and institutional inequities oftentimes are a challenge confronted and faced by our indigenous populations. Which is why we need to be sensitive to it, and we need to act affirmatively to change that. You know, we're going to have a guest on the show here at some point, I think, just to have somebody who can talk to us about those indigenous communities, so that we're thinking about them every day, not just on the once a year Indigenous Peoples Day. Let's go ahead and talk about some of the numbers that we have with us today. Two dashboards where we start with this one. Number of new admissions is 10. The 7-day moving average has moved up to 15. Remember, we got down to 12 three times, couldn't get below that, and slowly it's worked its way back up to 15. 133 new cases today. That's a number that is almost twice as high as our 7-day moving average. So hospitalizations at 10 stay low, but relatively flat. We can't move it down. Cases may be up. We're hitting numbers that are higher than our 7-day moving averages, and we'll see that again here in just a second. We're kind of at this precarious place, we see cities around the world now that are pulling back and closing things down and stepping back, and it's the last thing that we want to do, which is why I'm urging everybody we can't lose vigilance on masking. No matter how good things feel, or we can't do that until we have a treatment or a vaccine. 133 new people. Let's go to the next dashboard page. When we add that to the totals we had yesterday, that gets us up to a city total of 30,398 total cases. That's in the upper left-hand corner. Number of people hospitalized tonight is 88. The 7-day moving average, 84. So again, we're higher than the 7-day moving average. Also for ICUs, 32 people in our ICUs. As that number rises, the 7-day moving average is 28. And similarly again with ventilators, 18 is the 7-day moving average. We have 22 people on our ventilators. 442 people have passed away. That's an increase of one person who has now passed away. Still a dangerous disease, and we are on that edge right now, trying to hold on to opening up schools and opening up businesses. I want to remind everybody you can do in-home testing, in-home. All you have to do is reach out and ask for it. If you know somebody or have someone in your home that really just can't travel, we've reached out to 3,534 different contacts around the city right now to try and reach those in that population that need that kind of assistance. Hey, on Friday, the 23rd, which is next week, on Facebook Live. There's going to be a COVID-19 information for Asian American Pacific Islander community and friends. Topics to keep people up to date on resources for staying healthy. That'll be a week from Friday. I want to remind everybody that the city health department's talking about low risk activities for Halloween, so you might want to start planning for that. Carving pumpkins with people in your household, decorating your living space, hosting a virtual Halloween gathering rather than a big party. You can do that for a costume contest. You can do that remotely or virtually. Pumpkin carving at home, having a candy hunt or candy and a piñata at home are all real good things. If you celebrate Dia de los Muertos, they talk about cooking something with traditional family recipe. You can even share it with a neighbor, so long as you can do that in a no contact kind of way. Playing music in your home that the deceased really enjoyed and liked is a great activity. Decorating masks, making an altar for the deceased, and joining in again virtual gatherings with family and with friends. Austin Public Health this week is reminding people, hey, if you have even one vulnerable person in your household, then everybody in that household should treat themselves as if they were vulnerable too. Except for one of the low risk folks who you should send to go do the shopping and the like. So the most vulnerable never really leave the house. But if you live in a home with a vulnerable person, someone who's elderly or has a condition which makes them susceptible, then you have to be really careful yourself, or you may bring the infection home. Austin Public Health is pushing people to get the flu vaccine. It's now available all over the city. Last year, as you recall, we filled up our ICUs with folks that just got the flu. Well, Austin Public Health now has just launched its dashboard on the flu. It shows that the occurrence right now is minimal, and we need to keep it that way. Wearing masks for the virus is going to help. They also released a new public service announcement. Janine, is that something we can play?
Pandemic also, which we do not have a vaccine for yet. Now's the time to get the flu shot. We all must work together to protect all members of our community.
If I'm protected and I can stay out of a hospital, that's better for my community.
I'm getting this shot for the loving memory of a childhood friend.
I'm doing this for my parents.
I do it for my wife.
I'm taking this flu shot for my 3 beautiful children, my grandmother, and this great city.
I'm doing this for my wife and my 6-month-old son.
It's good for all of us to take precautions that can save lives.
I'm getting the shot for my parents. I'm doing this for my wife of 43 years and my kids and my grandkids.
For my wife. This is for my dear friend that reminded me about the importance of getting vaccinated every year.
For my community.
I'm doing this for my community.
I'm doing this for my community.
Y lo hago por mi comunidad.
For my community.
I'm doing this for my community.
You need to get your flu shot. You can do it through Austin Public Health. If you have insurance, you can get it done at pharmacies all around the city. Just takes seconds to do. You can go online and get an appointment at a time, so you're not waiting in line. Everybody should be getting the flu shots. I know a lot of people haven't done it in past years. This is the year to actually get it, even if you're doing it for the first time. They recommend it for children over 6 months old. So let's strengthen our community that way, because we are worried about spikes. Let's take a look for just a second at the University of Texas dashboard. Let's do that pretty quickly. I want you to see what the pattern first is in Texas generally. These are hospitalizations. This is the peak that we saw back in July. This is Texas. You can see as you move toward the right, the line in Texas looks like it may be moving upward just a little bit, mostly flat, but maybe moving upward. That's the dark green line. The gray lines are all the different possible solutions. Kind of flat, but God, those hints moving up. But let's take a look at Austin, which kind of looks a lot like the state of Texas. You can see ours there, maybe just a little bit more flatter than the rest of the state, but it's just been level for so long. We're kind of hanging on to the space that we have. But let me show you some of the other cities around Texas that used to look kind of like us. Let's look at Amarillo, for example. Here is Amarillo, and you can see, look at those numbers as they're beginning to head back up. They were up, they came down, and then they started heading up again. Let's take a look at like El Paso. El Paso, another part of our state that came down low just like we did, but then their numbers have started to go back up. This is in Texas. These are the numbers that we see. That's the dark green line. Let's take a look at Lubbock, kind of Texas tech country. Again, they were down. They were down and flat for a long time. And it doesn't take long, just 2 weeks, and you can see that their expected numbers are heading off the chart. That's what we have to protect against if we want to be able to maintain the opening of schools and be able to open up businesses. All right, let me sign off by reminding everybody that early voting starts tomorrow. It is the 13th. Travis County and Williamson County polling locations are open from 7 a.m. to 7 p.m. So check website for locations, wait times, how to download a ballot. You can download a sample ballot and take it with you into the polls, and you can reference it as you're trying to figure out how to vote. You can't take in your phone and use that, but you can print a sample ballot if you want to mark it ahead of time so you remember what it is you're supposed to do. Hayes County, it's from 10 a.m. to 7 p.m. Make sure that you bring your ID, bring a mask, bring your pen, and if you want to bring that ballot to a piece of paper to remind you how you're going to vote. But whatever you do, you got to vote. November 3rd is election day, but don't think of that as the day to vote. Think of that as the last possible day to vote. Make sure that you vote. If you vote early and get it done, that'd be the best thing to do. We need to vote in overwhelming numbers this year so that everybody participates in this election. It's such an important one. With that, make your plan to vote tomorrow if you can. With that, you all take care and be safe. Good night.